Welcome to the Bone and Joint Playbook with Dr. John Urse, where we explore an extensive range of orthopedic topics and insights. Our goal is to help you understand the available orthopedic options and treatments available, and hopefully give you some answers to questions you might have. We want to thank our following sponsors.
Ted's Authentic Greek Salad Dressing and Marinade. It's healthy, gluten-free, and delicious. You can find Ted's in Dayton, Ohio at Dorothy Lane Markets, Health Foods Unlimited, and Dots Markets. That's Ted's Authentic Greek Dressing and Marinade. Thanks, Ted.
We would also like to thank
Stifel's GWR Group combines more than 65 years of experience helping high net worth clients consolidate, coordinate, and simplify their wealth planning strategies. The group has access to a full suite of resources to serve all of your financial needs. Email gwrgroup@stifel.com or call 937-353-2863 to speak to Guy, Brad, or Jeff Richardson. Stifel, Nicholas & Company, Incorporated.
Hello, Dr. John Urse. We're here for our second podcast of the day. We're going to probably put this one out sooner because I have some questions for you, and then we're going to do something called Rapid Fire Orthopedic Fact or Fiction, correct?
That's correct. That's our topic of the day. And the reason we did it is we're going to just go through a lot of topics. Fast. And we're going to go through my blink response. And blink is your first impression of something you see or hear in the first 20 seconds. So when you look at art, you say, I like it, or I don't really like it.
Yeah, I agree with that.
What do you think? What do you think of this topic? And I'm going to give you my experience of 40 years in orthopedics.
40 years. You don't look that old.
I'm kind of old. Anyway, I used to put reverse greasing formula in my hair when I was younger because it made me look older. It added gray. But now I got my own. So I think what this will do for people is we're going to try to rate a topic. We're going to talk maybe about a fitted knee brace for your arthritic knee.
Sure.
And we'll give it a 1 to 10 rating, 10 being the most effective, 1 being not so effective. So we'll talk about fact or fiction. And there's some things that are in the middle, right? Things that we think might be promising or potentially good, needs more research, or things that we think are nonsense. And we'll try to sort some of those out.
All right. So before I go starting on this official fact or fiction list, we just had a record snowfall, right? Never had more snow, at least recorded out here. I had 14 inches at my house.
Yeah, that's a lot. And if it's not a lot for some parts of the world.
We just talked about Russia.
The Russian.
I can't use that again.
The peninsula. We have to talk about Kamchatka.
There's a picture.
They had 5-story buildings with snow drifts that were 2 stories above that. It was a record snowfall that they hadn't seen in 130 years. So there are things in nature that block us in. You want to get your car out. You got to get food for the family.
Correct.
And what do you have to do then?
I had to shovel the driveway. But I bought a really fancy snowblower back at Christmas. My wife got it for a Christmas gift. And man, was I grateful for that. But if I didn't have that, I'd be shoveling it by hand. And A, I could have had a heart attack. But B, I could have probably pulled something in my back. What's the most common thing that happens to folks when they're shoveling snow?
Well, they're using muscles they haven't used for a while. And they're putting stress and strain through parts of their legs, arms, and back that they routinely wouldn't do. Snow's heavy, and it depends how much you're shoveling at a time and how long you're doing it, how big your driveway is. So hopefully you've gone over and helped some little ladies with their walkways by cleaning those for them.
I did, but my batteries died. So sorry, little ladies. It's an electric snowblower.
Good deed of the day. Yeah. Charge it up. But I think what people are going to do, though, is they're going to come in with a sore back or sore legs.
Should they come to you, or should they just say,
they're not going to. First of all, they're not going to find me because we're closed because the snow is blocking all the people
from driving. But do they need to go see a doctor, or can they just wait this thing out?
They're going to go right on Google, and they're going to look up some AI application of low back pain and say, what should I do for this?
Okay.
And they're going to get a lot of good recommendations. Artificial intelligence is a good topic to start with.
Let's start with that because that's on my list. Can I trust it?
Yes. I think you could take a grade between 6 and 7 for artificial intelligence because you're going to get an organized answer that gives you options for your problem. And what you're not going to get is experience of a healthcare provider saying this could be more serious, it could be this or that, it could be something other than your shoveling of the snow that's causing the pain. You don't get that that part from a computer or an artificial source. But for general information, I think it's a 6 or 7.
All right, so it's a six or 7. I thought it would be higher than that, to be honest with you.
I think it's very good for organizing your thoughts on a topic.
Yeah.
It isn't going to explain how to fix your hammer toe. It's going to say, well, they stick some pins and do this and that.
Right.
You'd want to know, gosh, I need to talk to somebody. How long would I be off work? When could I play tennis again? I think there's a whole area of information that a computer can't tell you.
Okay, so we're going to start down the list with number 1 here. And again, this is 1, don't trust it. 10, trust it with your life kind of thing, correct?
Well, yeah, I think 1 will be, is it beneficial?
Does it have value?
Or does it have value? And 2, does it have risk?
Yeah.
Because if it's valuable but very risky, gosh, jumping off a bridge with a bungee cord is tremendously fun. Is it risky? Yeah, you can die. I mean, that you'd want to weigh correctly.
All right, so I'm more interested in seeing how you can make short answers, because I've done these podcasts with you for a long time, and getting short answers may not be something that's easy to do. But my job is to keep you on target. Ready? Number 1, gel shots for arthritis. People tend to get these things, good or bad?
I give it a 3.
A 3.
And the reason is that gel injections only work on about 60% of the population. So 40% are paying in the thousands in U.S. currency for a gel injection. It's supposed to last 6 months, but it routinely doesn't. And it's not proven to change the course of knee arthritis. It does add some lubricant that the body loses as joints get arthritic. So some insurances pay for it, others don't. There are better options for that.
So that's a 3.
We did a topic on this. We did a YouTube video on gel injections of the knee.
No, it's been a while ago. Yeah.
Look that one up.
My memory retention is not great as I get older. Fitted knee braces for arthritis, good or bad?
Definitely good. About an 8.
8.
So if your knee is bowed and you said, hey, I have a lot of bone-on-bone arthritis rubbing on the inside of my knee, or on the outside in your knock-knee, as they call it, a brace that actually offloads and aligns the knee straighter will help you walk better on uneven ground on a golf course.
Do you wear this all day long, or is this?
No, just when you're up on it. You don't need it in bed or in a chair, around the house, 5 steps to the bathroom. But if you're going to be on your feet, you're going to go watch your granddaughter's soccer game, and you've got a bad knee, you're going to go shopping and be out on your leg all day. These are very beneficial. Now, they have to be fitted for you.
Yep.
They have to be measured. They're more expensive, but they're a good way to delay a surgery that you might eventually need to fix a arthritic knee.
Okay, ready? Next one, custom shoe inserts. And I got a brief story, but go ahead. Are these good or bad? Custom shoe inserts.
They're definitely good.
Really?
Yeah, probably an 8.
Wow.
So if you've got, let's say you have a fallen arch or a high arch in your foot. Let's say you have arthritis in the middle of your foot and the bones in the midfoot, they call it, between the toes and the ankle. Maybe you have ankle or calf pain. Even low back pain can be dramatically improved balancing the feet. Think of a 4-legged table where one leg is shorter and it's uneven and it wobbles.
Yeah.
You put a shim or a couple matchbooks underneath one short leg, and it balances that out. And a simple thing like that makes a big difference in the lower extremity or low back. And I have patients who have told me their back pain's been completely cured with inserts that were fitted for their foot anatomy. So there are off-the-shelf ones. One size fits nobody. You get them, you put your feet in these little things at the store, and you pay $10 for them, and they probably aren't as effective.
Well, but let me tell you quick. I thought, because I had Taylor Bunyan, right? We talked about this when you were giving me some free advice, and remember what free advice is valued at.
It's worth what it costs.
It's worth what it costs. But I went to one of these stores, and first off, they did all kinds of crazy stuff, and I thought, wow, this is great. A little piece of plastic was over $2,000. I couldn't believe it. Not that hopefully I'm not going to name the store, but it was out of control.
Well, did it help you?
I couldn't tell it. It was a pain in the ass to walk on. So I got out of that, and I said, I got a wider shoe.
Expensive lesson to have learned.
Yeah, I got a wider shoe and longer shoe, and the pain is really going quite away.
Well, that goes to the good shoe box and bad shoe box. So if certain shoes hurt your feet or legs or back, they go in a bad shoe box under your bed. If you haven't worn them in a year, give them away to a charity, get a tax write-off. Your good shoes, we've seen some shoes in some previous podcasts, they can be quite expensive, but you can go buy some more good shoes once you find the ones that are right for you.
All right, cortisone shots, injections for all kinds of pains that you might have.
7.
That's pretty good.
Yeah, they definitely work. The problem is we don't know how long they'll last. I call them wedding bell blue shots. If you have a wedding in St. Louis next week and you're going to want to walk up and down the aisle and take your daughter to be married to some guy you don't trust, you're going to walk better with a cortisone shot.
Yeah.
You'll see your quarterback on your team play better. The problem is cortisone has some side effects. It isn't the best thing for joint cartilage, but it definitely controls inflammation. It's fast acting. It gets into the area instead of hoping a pill that you eat is going to go through your body into the knee. It's
But how long does it last?
Probably, I'd say months. It's usually 2 to 6 months.
And does that
sometimes less, and certainly subsequent injections less duration of benefit.
So the next one is anti-inflammatories, right? Like Advil and things like that. Does a cortisone shot work the same way as that, or is it a separate way? Is one just killing the pain and one's actually...
No, they both help inflammation. So I always tell people steroids or cortisone is a monster anti-inflammatory. It's the strongest. It has local acting ability. So if you put it in your hip or knee or in a tennis elbow or in different places, you can get some immediate relief because it cuts down inflammation in that area. It isn't going to help. A shot in your knee is not going to really do much for your sore shoulder or neck, but a pill you take, an anti-inflammatory like Advil or Aleve, can help. It's systemic, meaning it's in the whole body.
Yeah.
It will help different areas. It can help a headache or a toe. It doesn't know where it's going. The problem is that those have side effects. They work, but medicines that can also hurt your stomach or kidneys in the long run aren't good for you. We've talked about safe alternatives. We may talk about those later today. But in the short term, those are okay to take if they're okayed by your doctor, if you're not on blood thinners, if you don't have an ulcer issue, if you don't have kidney issues. Those are two-edged swords.
What's my number?
Anti-inflammatories.
Anti-inflammatory?
I'd give them a 6. They work.
Okay.
A lot of people use them.
I take them. I mean,
just
my neck hurts. I take them.
much like some of our bad habits, anything in moderation.
All right. This is right up your alley. I expect you to give me a 10, but, again, you're an orthopedic surgeon. Total joint replacement.
9 or 10.
I kind of knew that was coming.
Well, they're life-changing. Okay, the arthritic hip that you're walking around on, when it gets replaced, you throw away your crutch and you walk. It's life-changing. It is a surgery, though. It has complications. It has potential. We talked about finding the right person to do it.
Right.
Finding the right time in your life to do it, but life-changing.
Okay, so you're high on that one. Wouldn't expect anything else other than that. This one I don't know much about. We've talked about it, but embryonic stem cell.
Right. So
that's stem cell from
a mother's placenta, usually what's called a fetal source, and there's a placenta cord between the baby and the mother. Baby goes off to the nursery with mom. That placenta can be harvested for cells called stem cells. They are unfortunately processed in a factory, placed in a syringe. I would give those a 2 at the most.
A 2.
Only because, number one, they're not FDA approved, so our Food and Drug Administration does not allow the use of those for musculoskeletal problems.
Yeah.
They have potential civil action against healthcare providers who do that.
I remember that, yeah.
But there was a lot of vague guidelines for a while, so they became very overutilized, I'll say, and overcharged, as you were talking about with your shoe inserts. So there is the problem is the cells are not alive. They've been processed in a factory, put in a syringe, marketed in a box with a salesman to a health provider's office, and then sold to the consumer who has no information at all about them except hyperbole. So I would just say 2 with trending toward a 1.
So we'll come back and talk about
probably
the other
not
ones. Yeah.
harmful to people, but not effective.
Okay.
Not scientifically proven by any means.
All right, physical therapy, PT. Is this something you highly recommend? You don't recommend? Good, bad? Give me the number.
Highly, I'd say 7.
Really? I kind of thought you'd be higher than that.
Yeah, only reason is some people don't benefit from it. Some people do the wrong type of therapy. A good example would be shoulder problems. When you raise your shoulder and you squeeze the bursa, if a therapist is having you pull these tubings above a right angle, you're squeezing the rotator cuff, squeezing the bursa. You're actually making your what's called impingement or rubbing worse. So there are ways therapy can worsen a problem. You can get overzealous therapists. You can have fragile, boned or weak muscled people who really aren't getting the right therapy.
Right.
I think it's overall good. It's never bad to strengthen muscles, improve flexibility, even in the face of arthritis. So the evidence for it is strong, but I have a caveat that some patients have to use it as a barometer for how it's working for them.
So testing, when you or somebody else is ordering a test, are they just playing it safe to protect themselves from malpractice, or is this something that you think everybody should be ordering as many tests as possible?
Definitely not one or the other. Okay, the best way to treat problems is to ask how long have they been there. Your back hurts. You were shoveling snow yesterday.
Yep.
You don't need an MRI of your back. Okay, you overdid it. It's going to get better in a few days of rest. Bend your knees, turn on a good movie, get some popcorn. If you have a 1-year problem where you can't lift your arm, and this finally brought you to see me, you've lost function, you can't put a dish on a shelf, you need an MRI to see if your rotator cuff is torn, or an ultrasound, or an imaging study to diagnose your problem, because we always start with x-rays and a physical examination,
right?
And then we say, look, has this, or let's say the timeline is shorter, but your son is on a soccer team, and you're in a division playoff game this week, and he's hurt his knee or ankle. That's an exception. We need to know if little Billy can play. We're gonna push to get that test done sooner because we want to make sure it's safe for him to play, and we're not going to cause more harm. And if it's nothing too bad, we're going to say, let's go ahead and let him see if he can go. It's an important game.
Right.
The parents, the coaches, little Billy wants to play. Those things all should come into your decision making, and that's what separates what healthcare providers do from artificial intelligence.
Okay. This one was a good one. CBD gummies for pain.
2.
Really?
Or 1. I don't think they do much. I think they're over-promoted. They have very little pain-controlling function. If we do a topic on medical marijuana someday, the cannabis plant, majority of the benefit for pain comes from the THC portion, which in some people's minds is going to make them feel woozy, like those kids that hate Ashbury and the anti-war rallies. But there are very well-regulated forms of THC drops that can be given under the tongue for people with chronic pain conditions by licensed physicians who are authorized to prescribe it. So the THC portion is much more beneficial than the CBD, which is the cannabis
How long does
portion.
does the THC part last?
That's varied on the dosing. You're probably looking at 6 to 8 hours. There's different times it has to be redosed based on what the conditions are. Medical marijuana is mostly legal in the United States now. Recreational is a state
By state,
varied control. I think globally, though, certainly there is more acceptance around the world for this. Many healthcare providers, I think, have changed their thought process to thinking if you're going to use something that's legal for your problem, it's one less problem I have to solve. So if it's safe and it's not going to hurt you, I'm okay with it. I think those are somewhat overcharged in price. I think their science behind it is less than substantial.
Right.
So I'd put it in the fuzzy category of whether it's beneficial. I would lean away from it on the
Okay.
CBD things. Not that you can't do it. I just don't know that it's that efficacious.
Can I throw a one off we didn't write down, kind of go over to make sure we know what we're doing? Can I throw one at you?
Sure.
Chinese medicine.
Probably a 7.
Really? You think they know stuff that we don't know?
Absolutely. Acupuncture is beneficial. I think forms of meditation for pain control. I think herbal remedies, many of our herbal remedies here started in China or in Asia, certainly South America and Africa. Those plant-based origins for medicines translate not just for pain. Digitalis, which is a heart medication, comes from a foxglove flower plant. Many of our tree barks, maybe we'll talk about Boswellia later, comes from the tree bark from a Brazilian tree. I mean, these are well established. Aloe comes from a plant. We use it on burns, and it's very effective. So
I think acupuncture is got some value to it.
I think it does. I think it's not very well understood in America. I think it takes a large area of discomfort and makes it smaller. I don't think it eliminates the problem. I think it's user dependent and operator dependent.
Yeah.
So I think it's something like anything you should see if it helps you, and it's minimally invasive for. It's not going to cause you side effects like a drug.
Right.
You would see how much it helps and whether you're going to be tied into 50 visits and drain your bank account.
Well, that's interesting. I was thinking about as we go down this list. What about Facebook things you see on Facebook?
Well, Facebook remedies are plentiful, I'll say, and they will ask you to order special oils, special creams, a little bit of a snake oil component to those, very minimally tested for what's called evidence-based medicine.
Yep.
And that is really the buzzword in healthcare now is does the recommendation you're using have evidence behind it that a cortisone shot works? Show me a study that shows a placebo versus that.
Yeah.
The cortisone patients were much better. We may talk about PRP or platelets for knees.
That's coming up.
And there's what's called promising literature for that, but more needs to be done on dosing and different things. So I think the main thing is find out what you can about things. The internet is great for that. AI is great for getting resources for information.
Sure. All right. We had written down here, because my wife wore one of these thumb and wrist splints.
7 or 8.
Wow.
Yeah. So if you have an arthritic thumb, more common in women because of hormone changes that men don't have.
Yeah.
The base of the thumb swings on a little bone called a trapezium.
Okay.
Think of a
Trapeze.
high aerial trapeze artist.
Yeah.
So that little joint becomes painful, sometimes swollen or bumpy. You'll feel bone spurs. A little thumb splint can protect it by keeping it from wobbling and let you use your thumb and not have as much pain. It's usually fitted by a hand therapist. Very effective, not curative, but effective. Same thing with a wrist splint where we talked about carpal tunnel, where the wrist, when you sleep, people get more carpal tunnel symptoms by probably bending their wrist when they're sleeping and not knowing it, kinking the nerve, causing more numbness, or they're not milking their fingers while they sleep, which decreases fluid in the carpal tunnel. So a splint that holds it with some side stays can help patients with carpal tunnel. Pretty easy to do. Put it on before you go to sleep.
All right. That's a good one. This one, I'm a witness myself to. This next topic is effective. I had shoulder issues, go to sleep at night. My shoulder would hurt, rolling the shoulder, it would hurt. And you said, Boswellia and turmeric. And you just kind of shot him and I said, which ones? He said, send me pictures of the ones you're going to buy. And I bought them. And I've been taking them now for years. And my shoulders are pretty good. I don't complain about them much at all. So Boswellia, flaxseed, cumin, turmeric, things like that.
Well, those are herbal remedies, and they are what are called safe alternatives to anti-inflammatories. You mentioned Chinese and herbal medicine. These have been around for centuries. The Boswellia is we talked a little bit about coming from a tree bark of a Brazilian forest. But some of these are derived from different sources. Curcumin comes from the curry plant, turmeric from the same plant, but poor gut absorption from turmeric. So only 2% of turmeric is taken up by the gut. If you add black pepper called bioperine to turmeric,
that's the one I bought.
You have a 2,000% increase in uptake in the gut. So it's much more effective to the body. Otherwise, you're just taking a pill that goes right through your system and doesn't get absorbed. So we did a podcast on safe alternatives.
Yep.
If you look at that on your provider social media options.
It's been a couple years ago, but yeah.
I typed out all those doses of the different options of boswellia, fish or flaxseed oils, some of the curcumin or turmeric. Those are safe alternatives. I think there are some trouble with reliability between brands, and the FDA in our country doesn't regulate the vitamin industry. They can't figure out what to do with vaccines, so they certainly aren't worried about your knee arthritis.
All right, so next topic. We only have two more.
Let me finish one thing about that. If you don't get a benefit from your new vitamin or nutritional, A, it's a bad brand and doesn't contain what you thought the label said, or B, it isn't working for you. And after about 6 weeks, you should switch.
You should come up with your own brand of herbal remedies. Dr. Urse's remedy of turmeric, right? And put your face on it.
I'm just in the information distribution business.
Yeah, all right. Next one, which I find hard to believe, is things like castor oil, things you rub on joints. You're telling me in our pre-discussion that's...
I'm going to say 2 or 3. I think you can put on, there are things called Voltaren gel. There are castor oil liniments. There are some things like frankincense and some other topical applications where the smaller joints, like the thumb, you don't get a deeper penetration, more than an inch or so, couple centimeters for you metric lovers, but it doesn't get deep into the hip joint. I mean, so putting something on your skin, thinking it's going to get in your hip, is not happening. Okay, even those ultrasound methods only penetrate an inch at the most. They don't get to your hip bursa into the depths of the hip joint, inside your shoulder joint. So maybe on the thumb or wrist, some of those topical things are more effective.
Yeah.
But I think they have very little downside as far as causing harm. I just don't think
lidocaine patch is not in that category because
it's in a separate category because it's like a 12-hour numbing patch.
Yeah.
So Novocaine, like we get at the dentist, is lidocaine, and that can numb an area and provide temporary pain relief. It is an over-the-counter medication. There are prescription strengths that are slightly stronger, but they are certainly okay to put on an area. There are some that are warm and some are cold, but there are certain patches that just go over a sore area. You'd never put them over an open wound or an area that was red or inflamed. It's not meant to cut down inflammation. It's more for, a sore spot that you were shoveling snow. Go ahead and put a patch on your back.
So last topic, drum roll, please. And I know you like this one because we've done multiple podcasts on this topic. And this is PRP treatments, not using the
bone marrow.
Bone marrow, yeah.
Right. So PRP is platelet-rich plasma. It is a emerging technology, I'll say, at least in North America. Probably been here about 10 years, certainly around the world much longer. That's called an orthobiologic because it's used in orthopedic appliances, orthopedic applications for your using your own biology, which is your blood.
So you're taking my blood out.
Taking your blood. We tell people, drink a lot of water, come into the office, we draw your blood. We can find the portions in the blood that we want for a certain area. In your joint, we might want to have a few less red blood cells, a few less white blood cells, but we like the platelets. We want a high concentration of platelets, so we draw a lot of blood. There's a lot of promising literature in this area with treating knee arthritis, tennis elbow, tendonitis, bursitis, but it's all over the place because the amount of blood people draw, the concentrations of platelets people get, lead to various outcomes in the literature. So if there's 1,800 articles and 60% of them aren't favorable, the news media picks that up and says it doesn't work very well.
Right.
The problem is the reviewers who look at the articles should say, you didn't draw enough blood. It's not a good study. Why comment on it? Or you only followed the patients for 2 weeks and they all got better in 4 weeks, but you didn't wait long enough to ask them questions or report on it. So some studies can be flawed. In fact, many are. That's why when we look at evidence, we look at proven, we look at something that's promising, we look at things that are kind of hazy.
Right.
We look at things that are nonsense, that don't work and never have worked and been proven wrong with studies. So I think this is a promising field for non-operative treatment of chronic problems. Number one problem that disables people in the world is arthritis.
Yeah.
Okay. I mean, you higher death rates from cancer and heart disease, but debilitating wise, it'll be, in my opinion, platelet-rich plasma will be the first-line treatment above cortisone, above gel for knee arthritis in the future. And there are some insurances that are slowly moving toward that, and they've approved it. Some of our military insurers do that for our military people, for tennis elbow, for knee arthritis.
What's my number? What's my number on PRP? Give me 8, 9, 10, 3.
I'd call it a 9.
Ooh, that's a high one.
I think it's tremendously beneficial.
Okay.
But it's not well understood. Many healthcare providers won't take the time to understand
And this
it.
lasts forever. I mean,
No, it does not last forever.
How long does it last?
It's probably, you should plan on 1 to 2 years. I have people that have been better for longer than that.
Yeah.
Nothing works on everybody. Some people don't get a great benefit from it. We found that there's certain things that have to do with the concentration of the platelets, perhaps how many times it's done. But it is marketed in different areas, some less scrupulously than others. And again, the FDA is not really observing what should be done with this. So it's up to the patient to do their due diligence. It's up to insurance companies at some point to decide, do I want to pay for a surgery, or would I be able to postpone it by approving something that might delay surgery or hopefully avoid it? And it may need to be repeated. I can tell you, if you're a sports team owner and you want your baseball pitcher to get back sooner and you have a partial injury to your shoulder, you're going to somebody for a PRP injection.
Oh, wow.
Like now. And that will get you back in the game. We talked a little bit about Tommy John surgery for elbows. Partial tears that aren't completely separated are being treated with the PRP with significant benefit and avoidance of the Tommy John surgery. There's articles that show that. I know some of the authors of those studies. And again, I'm not in the convincing business, so many of my colleagues just don't want to hear about this, and that's their choice. But the consumer should be the person that does the AI research or the literature search or looks around the world and says, what are people doing for these problems?
All right, so this concludes our rapid fire ortho fact or fiction episode. By the way, I love these things because I learn a lot.
Well, I want to thank our sponsors.
Please do.
Ted's Salad Dressing. It's a great Greek salad dressing and marinade. And we also want to thank the GWR Group with Stiefel Nicholas, Guy Brad, and Jeff Richardson, who are great financial planners and advisors for people. And Tri-Level Recordings. Make sure you like the Bone and Joint Playbook on your social media platforms, and tell someone if they want to hear what we're pontificating about today. They can.
What part of Russia are we trying to target? What's that?
Kamchatka Peninsula.
Okay, Kamchatka people, if you're here out there, please text us. We'd like to know how that snow thing is doing. All right, folks, thank you very much. We'll see you again on the next episode of the Bone and Joint Playbook with Dr. John Urse.